A lot of times people want to stretch their hip flexors, and what I see is not being done right. So this is an alternative and something for you to consider. Stay tuned. Hey, I'm Dr. Shaki from Irvine Spinal Wellness Center, your posture and chiropractic clinic. Your hip flexors are being used quite a bit because we're all sitting behind the computer and it's just in a shortened state. The alternative to laying down on the couch, or not the couch, but on a bed and letting your leg drop, which works if you do it right, but then that's a big if, is what we all did before we started crawling at about 6 months of age. So what we're gonna do is we're gonna go into this position from the quadruped, from all four, keeping your spine tabletop. That's the key. So I've done a video on how to breathe biologically. I suggest that you watch it at the end of this video, which we'll add. So I'm just going to jump into that position. So you want to be pushing the ground away. Your elbows are not locked. Your across your shoulder blades, they're nice and flat. Your neck is not down here. It's sliding up without you locking your elbows. You're going to go and bring your knees back a little bit. So you're going to stay in this position, still pushing the ground away without locking your elbows, gliding your neck up, and now you're using your knees down to the foot to press down while your thigh bone inside the socket is supporting those two corners nice and strongly, and you're pressing down into your pelvic diaphragm. All of these are terms that you need to educate yourself about. They're all in my YouTube channel. So you're gonna hold yourself up in that position so you're not going down this way like cobra. You're not squeezing your butt to hold you up, but you're allowing the small of your, the lower ab to do its job, contracting and matching the lower back muscles to hold this region up like so. This is an excellent exercise, allowing your lower ab, your lower back working together as you're pressing down on the the pelvic diaphragm, maintaining your barrel to hold you up. This is how you strengthen the torso, and in the process, if your hip flexors are too tight, they let go. The reason they're tight is because your lifestyle is resuming that position, and in the process of that, your lower ab and your lower back go out of the picture. So in situations where they need to jump in and do their job, your hip flexors are basically supporting your torso. This is very important. Your hip flexors should not be supporting your torso or your lower extremity. They're supposed to provide an action, but when they become the supportive structure, stabilizing you, then we have a problem. Hope this helped. I know this was very technical, so if you're not familiar with the terminology, I suggest you explore the YouTube channel I have for better understanding. Subscribe to the channel so you'll get on the bandwagon here. And if you have any questions, make sure you use one of the methods of contact in the description box to ask your question. Until next time, take care.